moving from a sedentary to a physically active societal way of life. This is Up on Our Feet.
Welcome to Up on Our Feet. Over the past few decades, there have been major advances in modern medicine that have enabled people to live longer. New prescriptive medicines, innovative surgical techniques, technological advances for dealing with the major chronic diseases of diabetes, heart disease, cancer, stroke, all enabling people to live longer. However, there's been an unintended downside to people living longer, and that is, as they do live longer, they're more prone or likely to develop forms of dementia, especially Alzheimer's disease. So yes, we've had medical advances in modern medicine for dealing with a number of chronic diseases, but not for Alzheimer's. For now, there's no pill, no form of strategy or technology to prevent it. However, not from modern medicine, but from millions of years of human evolution, research today is showing us that for most people, not all, but for most people, there is a way to significantly reduce the risk of developing Alzheimer's disease, and then for those who do develop it, to slow its progression. And our guest, Professor Laura Middleton of the University of Waterloo in Waterloo, Ontario, Canada, about an hour's drive from Toronto, is someone who has been researching this issue and implementing strategies and programs for reducing the risk of developing dementia, especially Alzheimer's disease. Professor Middleton, it's nice to have you with us.
My pleasure. Thanks for having me.
Sure. Okay. So let's start in general, and then we'll narrow things down. What exactly is dementia?
So dementia broadly is an umbrella term. It doesn't describe one disorder, but a set of symptoms. So dementia describes when you've experienced enough change in your thinking abilities or your cognitive function that it's starting to affect your everyday activities. So your ability to get dressed, plan out your day, look after your finances, when you've experienced enough change in your cognition that it affects those abilities.
Okay, then what is mild cognitive impairment?
Yeah, so mild cognitive impairment was framed as an at-risk state for dementia. Not everyone will go on to dementia, but mild cognitive impairment is when you've experienced a change in your cognitive function, but it's not yet severe enough to have a significant impact on your daily activities. So
Okay.
you might notice it, it's noticeable on tests, but you're still able to be independent, fully engaged day to day.
Okay, so is mild cognitive impairment just a product of normal aging, or is it more than just aging?
No, it is a faster decline than normal aging. In normal aging, there's certain types of thinking abilities or cognition that decline. Other ones, like your vocabulary, your knowledge of facts, can actually continue to improve with aging. But even mild cognitive impairment represents a faster decline than we might expect to see amongst older adults.
Okay. Alzheimer's then. Alzheimer's is a full-blown form of dementia. How does Alzheimer's develop in people? What exactly happens? And would you talk a little bit about amyloid beta and the tau protein?
Yeah, I'll talk a bit about that. Now, I would not profess to be an expert in the neurobiological mechanisms underlying Alzheimer's disease, but I can speak a little bit to it. So first of all, as you said, Alzheimer's disease is one type of dementia and the most common type of dementia. So depending on how you define it, it might be 50 to 75% of people with dementia will have Alzheimer's disease. And I would say we're still figuring out the exact causes, but what we know happens is we know that there's an accumulation of what we call beta amyloid plaque on neurons. So that's much more common amongst people with dementia, and that there's, precursors to these plaques that we can see in those people that will develop Alzheimer's even 20 years before overt symptoms of Alzheimer's disease occurs. Now, there's also what are called, this is going to sound highly technical, neurofibrillary tangles. So that's a part of the neurons, the cells in your brain, that information flows along, and the accumulation of abnormal tau, as you refer to it, causes the information and nutrients not to be transported as well along these neural axons. So it's what we visualize is a tangle occurring. So, the transportation isn't as effective. And the tau can happen, the tau caused neurofibrillary tangles can occur in a number of different conditions, but the presence is quite strongly associated with the severity of cognitive deficits as well. So we don't think of it as much as being the main characteristic of Alzheimer's disease, but it is actually at least as predictive of actually the cognitive symptoms. Just the focus of most of the drug development has been on beta amyloid plaque, at least until the last few years.
Mm-hmm. Okay, so then besides these, the beta amyloids and the tau, what are the things that cause Alzheimer's? What goes on here?
Well, those are the main, neurological mechanisms, and we don't entirely know why it starts. Some people are at higher risk because of genetics, and the predictive strength of genetics is much stronger for young onset Alzheimer's disease. So that's when you're diagnosed before the age of 65. There's a few genetic markers that pretty much determine that you would get young onset, but those are quite rare compared to the prevalence of Alzheimer's disease. There's other genotypes like ApoE4 that we might hear about, and that increases your risk of Alzheimer's disease, but it isn't a determinant. You may still have ApoE4 abnormal type and still not get Alzheimer's disease. So those seem to be risk factors. But of course, separately to that, there's all sorts of health-related and behavior-related risk factors for Alzheimer's disease too that may either alter the pathological mechanisms, putting you at higher risk, or it may affect your brain's ability to adapt. So the neuroplasticity occurring in the brain. And those are things like vascular risk factors. So any vascular risk factor like hypertension, obesity, type 2 diabetes are all risk factors for Alzheimer's disease as well. Of course, as we'll talk about, physical activity is a protective factor. Healthy eating is associated with reduced risk, and particularly Mediterranean diet or closely related diets. A newer one that's been identified in the last 5 or 10 years is hearing impairment actually increases your risk of Alzheimer's disease and other dementias, and particularly if it's not corrected hearing impairment, although there's a lot more information that we need to find out about the link between hearing impairment and Alzheimer's disease.
Okay, so from what you're saying here, it sounds like that there's a strong indication that Alzheimer's is, or a lot of the people who develop it, it's a lifestyle issue that can lead to it. Is that correct?
Yeah. Well, they estimate that modifiable risk factors may account for about 40% of cases of Alzheimer's disease. That if we could correct all these, risk factors that we could actually decrease the prevalence of Alzheimer's disease by that much.
Okay. Then from a personal and social perspective, how does all this impact those afflicted by Alzheimer's? What exactly happens to them?
Yeah, so people with Alzheimer's, of course, have changes that occur with a condition. It's characterized by, cognitive changes, and these can depend a little bit. Alzheimer's, we often think about memory, but there's other types of dementia, and even in Alzheimer's disease, it can be, executive function, which is more planning and goal-oriented behavior, can be attention. There's all sorts of different, your ability to interpret visual information can change. And so these cognitive symptoms can affect your ability to engage, but also your balance and mobility can be affected. The way you interpret information and the way you respond to things can be affected, partly because sometimes people have more trouble with language, and so the way they respond, it's harder to communicate to people. So we think of sometimes behavioral problems, but often it's just a reasonable response that they can't explain as well. It's a response to this situation. But there's kind of the individual level challenges, but where it really becomes an issue is kind of the interaction between, the changes in your ability and the ability of our programs and services and supports to actually accommodate the needs of people with dementia. So we think about, systemic, barriers to participation, where, people often have a fear of dementia. They often think of it as really the end stages of dementia, where people have a hard time moving or communicating. But of course, when people are diagnosed, they can be quite active. They may still be working, they can still be social. But the stigma of dementia can often stop them from participating, either just because of overt expressions of stigma from the people around them, or because the subtle changes that you might make in your program to accommodate the needs of people living with dementia are just not considered.
Okay, so that's on the individual. Do you know, I don't know if you have this information, but what about the statistics on Alzheimer's? What's its prevalence today, and what are the future projections?
I should have been prepared with US numbers, Joel, because of course I have the Canadian numbers in my head.
Do Canada.
Okay, Canada. Currently, there's about 600,000 people living with dementia broadly. And I'll usually think of dementia because our ability to diagnose the exact type is not always precise. And that number is expected to more than double in the next 30 years. And this is similar to the US. So that increase is projected largely because, and you referred to this earlier, more people living to ages when dementia is common. We know we have the big wave of baby boomers coming through, where all of a sudden they're going to be reaching ages where dementia is common, as well as small changes in longevity. Now, where the longevity becomes an issue is more in developing countries, actually, where they're seeing rapid changes in the expected life expectancy, so that where countries like Canada and the US are seeing a doubling, those developing countries are expected to see a tripling in the rates of dementia over the same time period.
So this isn't just a North American issue. This is a worldwide issue.
Absolutely. It's happening all over the world. Almost every country is aging, with COVID-19, not considered anyways.
Yeah.
And so, and we think about those countries that might have lower rates now, but are going to see rapid increases. They may not have the same, social or medical structures in place to support these rates of dementia too. So it'll require rapid changes in those countries. Now, of course, there may be different family structures, different cultural approaches to dementia care as well. That means what that looks like will be different all over the globe.
Mhm. Okay, so with these projections, these are certainly troubling. And there's currently no pill, no surgical procedure technology, but for most people, not all, but most, they can significantly reduce the risk of developing Alzheimer's disease or slowing its progression. And in this context, you were the lead and co-author of a study in July 2011, about which you also presented at an Alzheimer's conference in Paris at the same time. What was your motivation for doing the study, and what were the results of the study?
Yeah, so, information had been emerging regarding physical activity and dementia risk for about 10 years before that study. Just the earliest work had come into place before I started my PhD, which focused on exercise in relation to cognitive change and dementia in late life. And so my original interest in looking at this was, one, I had a family member who had early onset Alzheimer's disease. My aunt was diagnosed when she was 47. And so the impact on her and her family was what motivated my interest in dementia research and in reducing dementia risk. My interest in exercise was, coming from an athletic sports background myself, knowing the widespread benefits to the cardiovascular system seemed to make sense. And just the first couple studies had started emerging again at that time. So, my work kind of from 2005 forward was all around exercise and dementia risk and cognition. But this specific study used an objective measure of physical activity. And what that means is it was measured directly. It wasn't just reported by people. So normally when we look at physical activity levels in relation to health outcomes, people are reporting what physical activity they do. And I think we all know, unless we're tracking it precisely, maybe an elite athlete, we're not actually very good at reporting our physical activity levels. We're often a little bit optimistic. We think about our best week instead of our typical week. And so there's all sorts of error in there, right? So what this study did is it used what we call doubly labeled water. That's very technical, but looking at the amount of energy you consumed over the course of a week. And so a lot of that, beyond your resting metabolism, will go towards activity. So we looked at this objective measure of energy expenditure in relation to your likelihood of developing cognitive impairment a few years later. And what we found is those people who are in the highest third of the physical activity levels actually had 90% lower risk of having cognitive impairment a few years down the road. And the people in this group weren't, at exceedingly high levels. Again, it's just the top third of the population. And so that group might have gotten the energy expenditure by doing, adhering just to the physical activity guidelines. So, that 150 minutes of moderate intensity exercise per week, or they could have done it by being active over the course of the day and just not sitting as much. We can't tell which one they did, but we know they spent more energy in activity, and that it really was strongly associated with a reduction in risk of developing cognitive impairment.
Mm-hmm. Okay, so you said 90, right? Not 19, but 90.
90%.
Right.
Now, when we look at the relationship between self-reported physical activity and dementia risk, normally we see about 30 to 40% decrease. And there's been many studies at this point. So that's probably where we land, but we saw a much stronger relationship when we actually looked at, measured energy spent in physical activity instead of just the self-reports.
Okay, so that means that those people who are most physically active in reality, compared to those who are least physically active, they have a 90% less chance of developing dementia, especially Alzheimer's. Yeah?
That's right.
Oh,
Now,
wow.
I wouldn't link it specifically to a type of dementia because it was a decline in it was cognitive impairment by the tests, but in practice, once you're diagnosed, it matters less the type. What it was a significant cognitive impairment.
Right. Okay, then just how does physical activity play a role in reducing the risk of developing dementia or Alzheimer's? What's the process here? What happens?
Yeah, and there's still lots of work that's teasing that out. When we first started looking at physical activity, people said, oh, well, it improves your vascular health. So, clearly your vascular health influences your brain health, and maybe that's why. And that probably plays part of a role. But what we know now is that physical activity also influences the structure of the neural tissue in your brain. So the neurons, the actual connective, the tissue that, conducts information. So it both contributes to the repair of neurons where there's damage, and can also contribute to the growth of new neurons and new connections between neurons. So that can help you in two ways. One, if there's damage, hopefully it helps, to have that repair process. But it can also mean that there's more connections even in a healthy brain. So having more connections means that if one area of your brain is damaged, you have more workarounds. You can almost think of if there's a traffic jam, you're out on your commute, you hit a traffic jam, it's easier for you to get around it if there's 10 different roads stemming from there, right? As opposed to one highway, no options to get on or off, right? If we have a well-developed architecture in our brain, lots of connections, then you have more ways to accomplish the same task. So it may help you retain function even if there is damage in your brain.
Mm-hmm. So, we've talked with a few neuroscientists about the connection between physical activity and cognition in the brain. So these are things you're talking about related to BDNFs, brain-derived neurotrophic factors, neurogenesis, neuroplasticity, yes?
That's right. So new neurons is neurogenesis.
Right.
Neuroplasticity is, either the repair or the new connections in the brain. And so brain-derived neurotrophic factor, BDNF, is one of the growth factors that contribute. Alongside that is what we might call VEGF, so vascular endothelial growth factor. And that kind of sounds like it just contributes to blood vessels, which it does, but it also contributes to the neuroplasticity as well. Because of course, if you just think about a neuron in the brain, it needs to have parallel blood supply for it to function. So often these, neurogenesis and new blood vessels happen together.
Okay, so we just threw around some technical terms from neuroscience. In a practical way, what forms of physical activity can people do to reduce the risk of developing Alzheimer's, other forms of dementia? Obviously, regular physical activity on a daily basis, but I think in your article I read that it doesn't have to be that. This could just be things like cleaning the house or mowing the lawn or taking the dog for a walk. Yeah.
Well, and this is certainly that study found that this overall energy expended in physical activity seemed to be really strongly associated. And that's not just purposeful exercise. That's any energy you expend over the course of the day. So mowing the lawn, doing household chores, going for a walk, any of those things. Now, the challenge is that when we go and try to do a randomized controlled trial, it's a lot harder to get people to try out this everyday activity. So normally when we get to these full clinical trials, it's purposeful exercise. So from that type of study, we know more about purposeful exercise, but it seems likely that the everyday movement may also contribute.
Okay. So from what you're saying, research I know that research in neuroscience, evolution studies, medicine has shown that as a species, human beings over millions of years of evolution have been genetically programmed to engage in sustained high levels of physical activity. When we do that, we're healthier, the brain works better, we're happier, etc. When we don't do that, we develop chronic diseases, dysfunction, despair. So specifically then, it seems that your research and work are validating this perspective through the positive connection between physical activity and Alzheimer's. And then taking this further from a general perspective, this implies that physical activity is nature's way, evolution's way of telling us that as a species, and given our lifestyles today, we need to be much, much less sedentary and much, much more physically active, not only for diabetes, heart disease, cancer, but also from what you're saying here, also regarding dementia and Alzheimer's, yes?
100%. I teach in a kinesiology department, which is really the study of movement. And so I always tell my students, we think of the brain as a thinking organ, right? But a huge portion of the brain is dedicated towards movement. It's not a side effect of healthy blood vessels, which is, the only reason the brain is benefiting. We have all the signals that trigger our movement, not all of them. There's a few reflexes, but most of them come from our brain. Our brain takes in the sensory information, makes decisions, programs the activities. It's really directing all of movement. So it makes sense. When you move, you're stimulating your brain that it'll react, right? And that it adapts. So I absolutely agree that, in modern society, we've gotten towards this very sedentary activity, and that has consequences. That has consequences for our body, but certainly for our brain as well, both for, cognitive disorders like Alzheimer's disease and other dementias, as well as for mental health and mood and anxiety.
Right. So really what you're talking about here is the impact of the motor system and being physically active and how it impacts the brain. Is that what's going on here?
That's my roundabout way of saying it, that the brain influences movement and the movement influences the brain, right? That they can't and don't exist independently. They are inherently connected.
Right. So this is like the integration of body and brain is what you're talking about and how they impact one another.
That's right. That's right.
Okay. So in this context, most people, live sedentary lives, basically sedentary lives, right? We sit at desks in school or in the office, we drive in our car, etc., and we have to carve out time for physical activity. So, when people are ill or they need some kind of treatment, they like to take the easy way out. They like to take a pill or something like that. How difficult then, given what we're talking about, how difficult is it to get people who you work with to not only start to become more physically active, but have physical activity continue to be a regular part of their daily life for the rest of their life? How do you do that?
And that is inherently the challenge, isn't it? Because most people know physical activity is good for them. Maybe this gives them one more piece that, your risk of dementia will be lower, your cognition might be better, but they already knew that physical activity was important. And so in the end, behavior change becomes the fundamental challenge. whether it's dementia prevention, improvement of function among people living with dementia across the life course. And so I would say in terms of behavior change, it depends to some extent who you're working with. I think that most of my work, of course, works with older adults, whether it's before dementia onset in prevention, or it's among people living with dementia to help them improve, their physical, cognitive, mental well-being. And I think that for me, perhaps the most fundamental contributor, and this isn't for everyone, but for many people, is the social influences they have around them. Often if you're in a family or in a community that's active, you'll be active too. And that may be right from the first points of getting them into a program or getting them into a routine, having someone to encourage them. And that's regardless of whether it's a friend or family member or an exercise leader, someone they're working with, but also a reason to keep being active, right? That you have those connections to the activity, that you have people that you're accountable to, even if you like to exercise on your own. And some people like it as a solo activity, but having someone who knows you're active, asks about it, encourages it, I think is fundamental to ongoing success at being physically active. And, one of the challenges that you alluded to is that that's no longer the norm in North American society, that, you're expected to study longer, to work longer, to, pursue maybe more sedentary activities so that, the time for you to be active, especially in a less structured way where you're not going for your 20-minute workout, but that's an option, but that you can get joy out of physical activity. That time is getting, smaller and smaller as the values of our society doesn't prioritize, being active and this leisure time where you can be active just for the enjoyment of it.
So really what you're saying, this isn't just a personal issue regarding how we deal with dementia, especially Alzheimer's. This is as much a societal issue as it is a personal one.
Absolutely. I think we can tackle behavior change on a one-off basis, but fundamentally, we need to tackle issues on a population level, on a societal level, if we really want to make long-term change for our risk of chronic disease, including dementias.
Mm-hmm. Okay. Final question.
Yeah.
From a big picture perspective, from all the research and work you've done regarding the connection and the impact of physical activity on Alzheimer's disease, what's the big message, the big takeaway, the major conclusion you've come to from all your work?
I would say the simple message is that if you want to improve your brain health and function, including risk and well-being, risk of dementia and well-being, take up physical activity as early as possible and stay physically active right through, even if you're diagnosed with dementia, because physical activity, the earlier you start, the better it is. But even if you don't take it up until after you're diagnosed, you can have a profound impact on your cognitive abilities, but also your mental well-being, as well as your functional independence and physical health.
Okay. Professor Laura Middleton of the University of Waterloo in Waterloo, Ontario, Canada. Thanks for being with us on Up on Our Feet.
Thank you, Joel. My pleasure.